Assalamualaikum. We are back with neurological assessment with me, Dr. Hiram. Today we talk about how we treat a patient with Parkinson's disease. Parkinson's disease usually increased in more in men than women and affect men about at middle age between the 40 to 60 years. Often the diagnosis of Parkinson's disease comes after a year or two after the symptoms appear. So one by one we discuss the symptoms that we also discussed in the previous video. The first one is rigidity. If there is rigidity, then the physiotherapist work on the stretching and flexibility of the muscles of the patient. Another symptoms is tremor, and unfortunately, physiotherapist not able to control the tremors but give strategies to the patient to control to minimize the tremors. Another symptom that is Parkinson's disease is postural instability, that is balance. That not comes right away, that comes later in the disease. So for this we make the patient to walk on different surfaces like on pillows, on foam. Patient asked to stand on one foot or standing with the eyes closed, open, and give different challenges to the patient in different situations. The fourth signs is bradykinesia. As we discussed in the previous video, that the bradykinesia is a decrease in the amplitude of the movement. So for this we make the patient to please increase the effort that you make. If you increase the effort, so that the amplitude of the movement will be larger. Parkinson's disease is not only the motor disorder, it also a sensory disorder. So because of sensory disorder, the patient also lose their positional sense. So they can't sense that is their amplitude is high or low. They can't explain that, and they can't differentiate that. Many patients with Parkinson's disease are unable to multitask. So for this we start from the simple task, have the patient master that task, and then we make the task more complicated. Now today I want to show you 3 exercises for the patients of Parkinson's disease that focus on how to improve the posture, rotation, and mobility. Patients of Parkinson's disease get a progressive hind position, so we want to offset this. We ask the patient to please go all the way forward, arms down, and with high energy pull it straight back. Quick and large movements correct the forward slumped position. Now this is the movement. As we discussed in the previous video, that the patient of Parkinson's have slower movements with the shuffling gait, with the less arm swing and less rotation of trunk. So to improve the rotation of the trunk, we ask the patient to please do like this exercise: quick and large movements. The arm go back, the forward, back of the end point, and then quick movement produced, and then bring it to the forward. In this way we can improve the rotation of the trunk. Now in the next exercise we ask the patient to please sit with the straight back and take your arms back out and extend them fully, and then bring them back to the one side. In this way we increase the rotation. In the next exercise, the both arms are extended out. As the both arms are extended out, and then bring back to the other side. Now in the next exercise we improve the patient's lateral posture. For this we ask the patient to please sit on the edge of the chair. Now we ask the patient to please bring your one arm up to the sky and the other arm to the down, and then bring across the trunk to the together, making a quick and large movement. In this way, we improve the patient's lateral posture. Thank you.